Hi all, and welcome back to hopefully part 2 of taping. And this taping video, we're gonna predominantly focus on upper extremity taping, specifically the wrist, thumb, and elbow for hyperextension. So just wanted to reiterate, make sure you guys are practicing tearing the tape before we actually start doing any of this, and make sure that you're proficient and comfortable, because you're not going to be able to tear or use scissors when you're tearing the tape between each of these individual body parts. So make sure we're gripping and ripping apart. Also, when we remove the tape, make sure we're pulling in line with the skin and we're holding the skin down and not just trying to rip it off extremely fast, because you can end up ripping some of the skin off. Okay, first we're gonna practice taping the wrist, and we need to make sure what we're taping for. Is it for support and stability? Is it to prevent flexion of the wrist? Is it to prevent extension of the wrist? So think of your goals before you even start taping. And same rules apply. You want to make sure the skin is clean, doesn't have debris, and you're using spray.
We're going to do a protective tape job for the wrist. We're going to start off, as most tape jobs, with a couple of anchor strips here. One is going to go through the hand, and one up on the above the wrist on the forearm. Everything's going to tie into these two, so it's very important that we get them nice and secure to start. We're going to make an X, which will go over the back side of the hand here. This is going to help kind of tie things in and prevent that forward flexion from being excessive. We're going to lock this in place with a figure 8. Every time I go through the thumb and index finger, I'm going to pinch the tape to make it smaller and make it more accommodating in terms of getting around the thumb area without pinching on the web of the thumb. We did a figure 8, which locks everything in place. That cross strip or the X strip that we did is now kind of held in place with that figure 8. At this point, I want to close in all that open skin area, so I'm going to ask you to go from side to side, from one side of the anchor strip to the other, halfway overlapping. That's our golden rule. And we're going to work our way up to the thumb. Now, we don't want to be on the thumb because there's not a problem with the thumb. It's a wrist that we're trying to protect here. So I call these basket weaves, and you can see that that's filled in most of the space that was open before. We're going to come back and we're going to do 3 continuous figure 8s. So we go around the hand, around the wrist, that's 1. Pinching every time we go through the thumb and index finger. There's my second figure 8. And I'm going to finish up with a third figure 8. At this point, we're just going to work our way up, kind of closing off and locking everything in place. We're going to work our way up the forearm to the very top. If I can go without tearing it, I don't have to tear. If I need to, if we have Popeye forearms, then I'll go ahead and tear that so that we can accommodate it. But it is a continuous wrap if possible.
Awesome. Thank you, Bobby, for that. Like I said, I'm at home. I don't have any pre-wrap or the spray, but I will go ahead and tape my daughter's wrist for you. Right now, you can take this moment to pause and try and practice on your own while I set up. Okay, so on the video that Bobby showed you, he had done the spray and the pre-wrap. We don't have any of those. This is little baby hands that I'm doing, so it might not work as good as I hope, but we will see, okay? So when we're having them tape, I know some males will have the patient flex their fingers and push it up against his sternum. We're not going to do that because it makes it awkward for some of the females, but I do want to make sure that you guys have your patient flex their wrist and forearm to make sure that their muscles are as big as possible and that we don't end up taping them too tight, okay? So you're going to have your hands out like you're making really, really big, okay? We will do an anchor strip, line it down, and again, hands out, even your thumb. And then when I fold it, I'll bend it. That way I can see where the bend's at, and I'll put it right in the webbing of the finger. And down. Okay, so you can tell this is a really baby finger. Okay, on the video, Bobby had them put an X on this back part of the hands to prevent flexion, but I want to show you a different way. We would have them supinate their hand, okay, and we'll do the X on the anterior aspect of the hand. That way it will help and prevent limiting extension. So like if you're in football and you're coming up against the line, okay, again, hands need to be flexed, and I'll just do a little baby X for little baby hand, okay, right here. And if you want, you can even put them in a little bit of flexion to help make it tighter for when, to prevent that extension. Normally I don't set the tape down, but I'm trying to work with a little itty bitty hand. Okay, so that's there, hand out. And again, I'm locking that down in place. Spread your fingers, baby. I know. Okay. So there's one. And then now I'm going to do 3 continuous ones. Every time I go through the webbing of her little baby hand, and this is going to be like a cast on her since she's so little. I might only do 2 on her, but on an adult, I would definitely do 3. Spread your fingers, baby. And then close up. Okay, so as you can kind of see with that, this little X right there is going to prevent that extension of the wrist. So make sure you're practicing, and we will get back to you in a second with the thumb. Okay, right now we're going to do watch protective taping of the thumb. This is one way that we can tape the thumb. If I have a little bit more time, I would actually prefer to do this one. If we're in a time crunch, I will show you a different one that you are able to utilize on the thumb.
Okay, we're going to tape the thumb now, and the thumb is a very small area, so we're going to tear the tape in half. The nice thing about most athletic tape is that if you start it in the middle, you tear it in half, it's going to stay at that same size. So basically we're going to start on the top of the hand going around the thumb as if it's a pylon and we're racing a race. So we're always going back to the place we started. So we have a finish line, we have a starting line. As I come around the thumb, I really want to have the tape stretched out so it's not too tight. This is a kind of a unique, sharp angle that we're going through, but if you look at this, we're basically just doing a figure 8, which is folded in half. On the back of the hand, you're always going to go inside the thumb and index finger. On the bottom of the hand or palm side, we go outside the thumb or around and back. We always end up in the same place, our starting line, which is on the opposite side of the hand, across from the thumb. We're going to spread the tape out as we move around the thumb and kind of go up and down so that in the end we've got tape below, on, and above the knuckle that we're trying to support. This is the base of the thumb that we're trying to get the support here. Now we've got a couple spaces here, and we're going to close this up by starting at the base of the thumb with a full-size sheet of tape. We're going to wrap around and attach it to itself, going around the outside area of the thumb. We're going to turn that over, and we'll see we have a similar situation on the other side. We want to cover that hole. We want to start at the base of the thumb, and we're going to work our way around, closing off where we started on the same strip of tape. Now, it's easy to get the tape too tight, so you want to make sure as you go around the thumb you don't pull too tight. We're going to squeeze this down like a handshake here and give it the same shape and form that we have on our wrist and hand. And then we're going to roll the edges down a little bit around the thumb, make it like a turtleneck sweater. This allows to take the pressure off. It allows us to be more comfortable and more functional.
Okay, so with that, don't forget to do the little bro handshake and roll the turtleneck on the thumb, basically. If the thumb is starting to turn purplish blue, that means that we've definitely taped them too tight, and go ahead and cut that off. And it just takes practice in not having that too tight. Okay, so a different way that we can end up taping the thumb, same thing, we're going to end up splicing the tape, the 1.5 inch tape. Same thing, we want to make sure that they extend their fingers, make a big hand as possible. And this one's a little different. I'm starting and ending on the same side. So on Bobby's, how you had kind of like a horseshoe, let me put the tape down, how you had a horseshoe on this side and then a horseshoe on that side. Okay, it's going to be a little bit different. So on this one, spread your hands. This one, I'm starting on the pinky side on the wrist, going in towards the thumb. I don't want you to move your hand at all, okay? And then when we come through on the hand. Okay. I don't know if you can see. So I'm going through the hand, pinching, doing it about 3 times, and it's halfway overlapping each time. Okay, hand out like this. And sometimes you have to be firm with your patients too when they don't understand. And then I would just tear it and leave it. So it's not as stable as the thumb tape job that we just showed you for Bobby, but this one in a kind of a quick fix where we're trying to limit that abduction of the thumb, we can go ahead and do that. It doesn't take an additional tape roll or anything like that. And last one, this is for hyperextension of the elbow. I want it on all of these. You need to make sure you know the correct rules and regulations for each of the individual sports. And I'll talk to you a little bit about that at the end of this video.
Okay, now we're going to tape for a hyperextended elbow. The elbow is a hinge joint, and it's very easy to get this hyperextended or extend beyond its normal limits. We're going to start with an anchor strip on the bottom, and we're going to go up top and we're going to put an anchor strip up there. A couple of strips of tape in both top and bottom will be sufficient for us to tie everything else to it. Allow full.
Okay, I do want to pause it here for 1 second and make sure when you're taping around the forearm, you have them flex their forearm so it doesn't make it too tight. Same thing around their bicep, tricep. Have them do a little flex for you, have them show you your muscles. That way, again, you're not enhancing the chances of them getting a tape cut or a tape blister.
Top and bottom will be sufficient for us to tie everything else to it. Now, in the hyperextension tape job, we're going to disallow full extension, or we're going to minimize full extension to the point where we can make it more accommodating in terms of pain-free movement. We're going to start our cross strips. It's easier to do it off of the arm. We're going to make an X using 3 strips of tape. We're going to put that from top to bottom, and we're going to seal this in and it's going to act as a strap for us to minimize the full extension. I like to stick tape to tape, so the sticky sided tape sticks really well to other sticky sided tape. So we flip it up, and we're going to go back over those anchor strips, locking in the bottom portion of this X that we've created. We're working our way towards the elbow, but not getting on the elbow. It's not a perfect circle, so you've got to angle based on the size of the forearm that you're taping here. When I've secured the bottom and locked that in place, I'm going to bend the elbow knowing that it's going to somewhat slip a little bit, so I give it a little bit more bend than I really want because I know it's going to accommodate to the movement that we're trying to get for this person to be functional. I pulled the tape tight, and now I'm kind of securing that down just like I did in the bottom. And basically I'm working my way from top to bottom towards the elbow. Again, we're not going on the elbow, but we're going down towards the elbow. This is going to secure the strap in place, and it's going to prevent them from fully extending their elbow, which is the best way to deal with the pain that comes from an elbow that's been hyperextended. Trying to be equal from top to bottom, the same amount of distance, and making sure that the strongest part of the X that we put on actually ended up over the middle of the elbow.
Okay, so let me go back just a little bit. And one thing I do want to talk about, if this patient were a wrestler, wrestling rules, they wouldn't allow this, or the officials would mandate that we have more tape over this, because right in here, let me see if I can have my little drawing thing. Right in here, maybe not, somebody can end up getting a finger caught in there, or whatever the case may be. So that actually is a super easy fix. We're just going to get some of our stretchy tape and go around in a circumference and cover that up to, again, disallow any type of way for fingers or something to be caught in there and potentially get injured. Okay. So this is for hyperextension of the elbow. Again, I would reiterate, make sure they flex their forearm, they flex their bicep when you're taping around that. Almost similar to how when we did the wrapping with an ace wrap, when we covered it, we had to put the little flag. You don't want to have to do that flag. So again, just make sure that they're flexing, and that will still help hold it in place. Okay, so now we're gonna end up taping her elbow for not wanting to hyperextend. So when, I'm gonna have you turn this way. Okay, make a muscle. Yeah. Okay, we're doing 2 anchor strips. Okay, and now you're gonna make a muscle right here. Show me your muscles. Come on. Sun's out, guns out. I made her put on a tank top for this. Okay, so we've got 2 areas for that base strip. Now you can kind of guesstimate how much tape you need, and I'll do what's called check reins. I'm just using the table right in front of me, doing anywhere from 3 to 5. She's just a little patient, so I'll probably be fine with 3. Some of our bigger guys, definitely 5, or we might, instead of using this check rein, we might use Elasticon instead. Okay, so same thing. This is where it's going to go on the anterior surface. And again, kind of like Bobby, I was one of Bobby's students. I like doing tape to tape, the sticky side to sticky side. So we're going to bend your elbow just slightly. I flipped this up. Make a muscle right there. Make a muscle. Good job. Okay, and we're going to kind of work our way up. You can tell I'm not very gentle. Towards the elbow, but not right on the elbow. Okay, and then you can always ask them to help you. So we're going to flex your elbow just slightly. And same thing, I'm folding that down so it'll be sticky side to sticky side. Show me your muscles. Yeah, muscles. Okay. And then I'll start working my way down. Okay, one more. Little baby arms, that's okay. Okay, and that's going to limit that hyperextension. Okay. If this were a wrestler, like I was saying, I would use some flexi tape to tape so we don't get fingers or anything kind of stuck in there. All right, so make sure you're practicing on your own. I know this video for the upper extremity is extremely short. Make sure you're practicing. I'm actually going to have you guys take a picture, at least 1 or 2 pictures of you taping, and send that to me for points. And then I'm also going to show you the grading rubric right now. All right, and like I told you guys, here is the grading rubric for upper extremity. This specifically is the thumb spica. So even though you don't have spray adherent or the pre-wrap, you can at least say that. Make sure you have an anchor strip around the wrist. Make sure the thumb is slightly flexed, kind of like making a C with the index and thumb, or like they're holding a can. Make sure you do 3 thumb spicas, and that first metacarpal phalangeal joint is covered, and you're doing it in under 2 minutes. Going down to wrist tape, we're going to make sure you're applying the spray adherent, making it in a neutral position, an anchor around the wrist, 1 around the hand, using a fan that crisscrosses either on the anterior or posterior aspect, depending on if you want to limit extension or flexion, and then secure the anchor strips in place, or secure the fan in place to the anchor strips, and close up on the wrist. Shoulder spica, we've already gone through that ace wrap, and again, we're not going to end up doing that for our practical. So feel free, go through onto the files component of our Canvas course, and there's an upper extremity and a lower extremity grading rubric, and that's what we're going to be grading those on. Make sure you're practicing, and feel free to reach out to me if you have questions on anything. Thank you, and have a good one, you guys.